Alright, we're going to be doing birthing and breastfeeding cross-culture examination. We're going to look at approaches to childbirth to decrease infant mortality and the benefits of breastfeeding. Birthing practices from ancient times that are beneficial. As you can see in this illustration, that woman has some help midwives around her while she's in standing position instead of laying supine, which is common practice nowadays. Doulas and midwives have been around since ancient Greek, Africa, and other parts of the world. They were even recognized as spiritual healers. Doulas and midwives have multifaceted roles, but both provide support and advocate for the women during pregnancy, childbirth, and postpartum, the most crucial part of the baby's development. Early African American midwives were crucial and widely used in rural areas of the South and often didn't have access to hospitals or trained doctors. As privatized medicine grew, out-of-home births fell from approximately 100% to 44% by 1940. Medical professionals started to rely on intervention methods such as cesarean deliveries, induction, and epidurals. Currently, 98.3% of births in U.S. occurred in hospitals compared to 1.4% at birthing centers and 0.2% at home due to government regulations. In recent reports, U.S. ranks number 33 of 36 of the infant mortality rate amongst developed countries. This might have something to do with the lack of doulas and also practices that are common nowadays that would not be used in the ancient times. Black and Latinos are more than 2 times the natural average to experience an infant or maternal mortality. Due to lack of quality care, structural racism, and chronic illnesses, as well as other variables due to lower social-economic statuses. Nurses are spread thin throughout the hospitals. In recent studies, a mother expected the nurse to spend 53% of the time offering support and only received 6 to 10%. So what is a doula? A doula is professionally trained in birth and labor support. She's supportive to the mother for physical information, emotional comfort, and encouragement. Effective buffers to harsh environments. She helps with form of pain relief by giving massages, and it helps increase oxytocin. There are clinical benefits. Fewer requests for epidurals, reduced use of Proctin, decreased rates of cesarean birth, and a better Apgar score for the baby. Doulas do not judge delivery choices. They create barriers with medical experts. They do not micromanage the birthing experience. And they definitely do not push personal agendas, protecting the mother's best interests during this experience. Here are some other health benefits to look at. So there's 34 fewer negative birth experiences, 40 minutes shorter labor time, and once again, 28% fewer cesareans. And then 12% more spontaneous vaginal births, and increased breastfeeding with prenatal and postpartum doula care. So as you can see, if we bring back the practice of having doulas, we will be able to mitigate our mortality rate. And these are just some other facts that go along with using a doula compared to a non-doula. So in some research studies, women with assisted birth were 4 times less likely to not have low birth weight, and 2 times less likely to experience birth complications, and more likely to be able to initiate into breastfeeding right after that first minute part, when it's so crucial for the baby to have the mother's touch. There's also mothers are more likely to breastfeed and delay formula use through education. And mothers also had an earlier onset of lactogenesis, where they were able to provide the nutritional breast milk for the baby to assist in cognitive development. Another practice that we're going to look at is squatting. Squatting position, as you see here on the image to the right, has been in many cultures worldwide for centuries until the 17th century of Western industrialization intervened. So when mainstream doctors came through, it was more convenient for the doctor to lay the patient in supine position when they started using those stirrups. So it was more convenient for the doctor, but not beneficial for the mother. So the benefits of squatting include gravity. Use that gravity to push the baby down, wider pelvic opening, shorter labor time, less need for intervention, and better oxygen supply. There is no medical evidence supporting supine position for birth, and 68% of U.S. women use this position. And once again, we are ranked number 33 out of all the developed countries. And also, squatting horizontal positions also promote perineal tears, and doulas can work with the mothers in the squatting position by holding her underneath her armpits, which would be double beneficial for the mother. Now we'll look into breastfeeding, which has had many stigmatisms against it. So the practice went to more of a common use of formula instead of nutrition valued breast milk. So breastfeeding benefits, who recommended exclusively breastfeeding for 6 months through some cultures do feed up to 2 years, such as in Turkey. Breast milk is the best source of nutrition, helps fight against certain illnesses, lowers the rate of SIDS, lowers the risk of mother's diabetes, ovarian and breast cancer, and high blood pressure. Breast milk is tailored uniquely for the baby to provide probiotics, antibodies, enzymes, and the perfect amount of protein for growth and development. Breastfeeding is also free, is environmental friendly, and it's always available, but not necessarily always convenient for the mother. Research studies on breastfeeding benefits for childhood development. Studies have shown that breastfeeding can result into higher IQ, higher cognitive functioning, and academic achievement. Studies also show differences between the corpus callosum with non-formulated babies and formulated babies. The largest difference was found in the primary motor and lateral prefrontal. Breastfeeding helps increase the function of central nervous system, promoting a positive development in the neurotransmitters. Researchers have found that not breastfeeding is costing the world $340 billion in medical costs that could be avoided. Exclusive breastfeeding is associated with lower odds for autism and lower risk of ADHD and other behavioral problems, suggesting that Piaget's cognitive developmental theory that development occurs in stages. So why are we not breastfeeding? So the lack of knowledge of benefits and the proper procedures, cultural and social factors sometimes seen as taboo, mothers are not receiving the proper support from healthcare providers or employers, misconception that formula is just as good as breast milk through advertising and marketing. Only approximately 35.9% of U.S. infants were breastfed at 12 months, a significant decline from 57% at 6 months. Some ties in the Western world to the influence of decline rates of breastfeeding was associated with the presence of the Catholicism influence in the region, which would show lower rates of breastfeeding, maybe because it was tabooed or looked down upon. U.S. maternity leave policy is also up to only 12 weeks unpaid leave, sometimes also paid depending on the company, compared to Norway's 12-month paid leave. Norway also has one of the lowest infant mortality rates with a breastfeeding rate of 78% at 6 months, so there's definitely a correlation there. Statistics of breastfeeding. According to WHO, the global rate of exclusive breastfeeding for the first 6 months is 41%, which is great, but UNICEF is leading a global breastfeeding collective pushing for breastfeeding promotion through policy change, education, including education towards males, which they find helpful for acceptance in the community, and promoting normalizing breastfeeding in public spaces, providing maternity leave, and allowing breastfeeding in the workplace. Here's a video that we can watch of breastfeeding, and you can go ahead and watch that.
When your baby suckles, it stimulates nerve endings in the nipple that...
So that was a nice illustration of the process of breastfeeding.